Ladies and gentlemen, welcome to the continuation of our Health Subcommittee that began yesterday, Tuesday, March 28th. Today is Wednesday, March 29. It is 4 p.m. and we are going to call the roll to detect a quorum for today's meeting. Ms. Adams, would you please call the roll?
Representatives Hicks, Jernigan, Leatherwood, Martin, Mitchell, Sherrill, Terry, Williams, Representative Hawk.
I'm here.
You have a quorum.
The chair detects a quorum. Once again, we are in continuation of the calendar dated Tuesday, March 28th for the Health Subcommittee, House Health Subcommittee. We are going to begin today on item number 12 on our calendar. I will mention, I believe we've got all the representatives, all the sponsors in the room, except for the last item on the calendar. Item number 19 is a bill by Representative Wright. I think we've got everyone in the meeting except for Representative Wright. He may be the only one that is not here just for purposes of bringing those in. So if Representative Wright is listening, he's item number 19 on the calendar. Any personal orders before we begin? Seeing none, we are now on item number 12 on our calendar, House Bill 942 by Representative Alexander. Representative Alexander. There he is. All right. Do we have a motion?
Thank you, Chairman.
We have a motion. We have a second. You are recognized, Representative Alexander.
Thank you, Committee.
We have an amendment, I believe.
We do.
5304, I believe that's going to make
correct.
the bill. We have a motion and a second on that. All those in favor of placing Amendment Drafting Code 5304 on the bill, please signify by saying aye. Any opposition, please say no. The ayes have it. We are on your bill as amended.
Thank you. This bill is brought jointly to me by the Tennessee Dental Association and the Tennessee Dental Hygienist Association. It's a result of a group effort led by the council and state government, including the ADA, the ADHA, and the U.S. Department of Defense and others. And basically what this bill does is that, as you know, our state touches many other states, and this will allow for dentists and dental hygienists to cross state lines and practice in other states that have reciprocal agreements.
Thank you, Chair Lady. Any questions? Chairman Terry, you're recognized.
Thank you, and appreciate you bringing the bill, and I believe we'd be the first
That is correct.
that does this, and so we'd had this discussion before, and I just want to make it clear that in the event that somebody builds a better mousetrap in another state as it relates to this, any of those things, we could come back and improve your fine piece of legislation. Is that correct?
That is correct. Right. It's just that somebody's got to start it, and it's great that we're getting to be the first on this one.
Thank you.
Thank you. Thank you for bringing the template to Tennessee, and hopefully others will join in. Right. I think it's going to take a few states to get the ball rolling on this, and it's good to be number one. Any further questions or comments of the sponsor? Questions have been called. All those in favor of sending House Bill 942 to Full Health Committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Committee. Thank you, Chairman.
Thank you, Representative Alexander. We are now on item number 13 on our calendar, House Bill 305. The request has been to take House Bill 305 off notice. Without objection, House Bill 305 is off notice. We are now on item number 14 on the calendars, House Bill 273 by Chairman Terry. Chairman Terry, you have a motion and a second.
Thank you. There's amendments, drafting code 6763 that
we have a motion. Amendment drafting code 6763 is the amendment we are choosing to place on the bill. It will rewrite the bill, so we're going to put this on and have the chairman discuss the bill after that. All those in favor of placing amendment drafting code 6763 on the bill, please signify by saying aye.
Aye.
Any opposed, please say no. The ayes have it. Chairman Terry, we're on your bill as amended for description. You're recognized.
Thank you, Chairman Committee. And we have worked with the Senate and the Department of Health on this language, and it will help provide the Board of Medical Examiners with some oversight with their medical consultant that is provided to them by allowing authorization, confirmation and revocation of their authorization.
You've heard the brief explanation. Any questions or comments for the sponsor? Seeing none, you ready to vote? All those in favor of sending House Bill 273 to full Health Committee, please signify by saying aye.
Aye.
Any opposed, please say no. The ayes have it. Your bill moves forward. Thank you. If you're working down the calendar, we disposed of item number 15 yesterday, so that is not on the agenda today. We are on item number 16, House Bill 1379. The request has been to take this bill off notice. Without objection, House Bill 1379 is off notice. We are now on item number 17 on our calendar. Chairman Kumar has House Bill 1317. Chairman Dr. Kumar, you have a motion. You have a second on your bill.
Thank you, Mr. Chairman.
We are looking at some amendatory language. Which is your favorite amendment?
It's 6749 today.
All right. Thank you. If you'll look in your amendment pack, we have Amendment Drafting Code 6749. Let's go ahead and put that on the bill, and we'll discuss as amended. All those in favor of placing Amendment Code 6749 on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. Chairman Dr. Kumar, you are recognized on House Bill 1317 as amended.
Thank you, Mr. Chairman. House Bill 1317 amends the Pharmacy Practice Act in Title 63. After the drama with our efforts last week, the sponsors and the Department of Health have worked in good faith, and the differences have been resolved presently. We will not vacate the board. The number of members on the board is increased from 7 to 9 by adding a practicing pharmacist to bring more practical knowledge to the board and adding a pharmacy technician, which is a first for this board. It enhances the provisions surrounding qualifications of the members, and it extends the terms from 6 years to 7 years, and the duties of the executive director are more sharply defined. It also allows the board to issue advisory rulings as well as work with licensing of pharmacy returns. With that explanation, Mr. Chairman, I hope for a favorable vote.
Thank you very much, Chairman Kumar. Chairman Williams, you're recognized.
Thank you, Chairman Hogg. Chairman Kumar, thank you. You and I had a great discussion regarding this bill yesterday with your Senate sponsor. I do believe this better reflects the original intent of what the bill was to do. But like you and your Senate sponsor, and I believe Chairman Terry as well, we do have some great concerns about certain boards in the Department of Health and their oversight, how they provide data and information to the members of the board. And so I think those interested parties on the boards of the Department of Health will be interested to know what happens over the summer as you and Dr. Terry and Senator Hale and many others begin to ask the difficult questions of how the information is provided is limited. So I look forward to seeing some change around this, but appreciate the bill. Thank you.
Chairman Dr. Kumar, you're recognized.
Thank you. I just agree that there are some systemic and structural issues of the relationships between the boards and the departments, and I think it's good that we keep legislative oversight. Thank you, sir.
And I'll agree with you, Dr. Kumar. That's the reason we do need legislative oversight. And sometimes only during session do we have time to take care of these issues. It may be that we need to do this more often. But I appreciate you working on this very much. Any further questions or comments for the sponsor? Seeing none, are you ready to vote? All those in favor of sending House Bill 1317 to full Health Committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Mr. Chairman and committee.
Thank you. We are now going to item number 18 on our calendars, House Bill 566 by Chair Lady Carringer. Chair Lady, you have a motion and a second. I think the timing of today's meeting being held when it is, that we do have an amendment that is going to be properly before us. Chair Lady, is that drafting code amendment 5757?
That's correct, Chairman.
Okay. Thank you very much. We have a motion and we have a second. Let's go ahead and get that bill in the proper posture. We will be voting to place amendment drafting code 5757 on the bill. Please signify by saying aye. Any opposed, please say no. The ayes have it. Chair Lady, we are on House Bill 566 as amended. Please explain your bill.
Okay. Thank you, Chairman and Committee. So House Bill 566 would create an Overdose Fatality Review Act, which would authorize a county to establish a multidisciplinary and multi-agency overdose fatality review local team and 2 or more counties to jointly establish a single multi-county team. Provides overdose fatality review teams and duties and responsibilities to examine and understand the circumstances leading up to a fatal overdose so that policy recommendations and resource allocations can prevent future overdoses. Just to go back a little bit on the amendment 5757, that would be removing the required section in there, law enforcement, so that the law enforcement investigative information would be removed out of the bill now as it stands. So what the Overdose Fatality Review would do, it would be a process of gathering and analyzing data on specific cases of fatal overdoses. So it would be similar to the Child Fatality Review that has existed in Tennessee for many years and has brought forth recommendations like safe sleep and the co-sleeping recommendations. So with this explanation, I will be ready for any questions.
Thank you. Any questions or comments? Chairman Williams, you're recognized.
Thank you. Chair Lady, I guess the question here is what when I look at the language, I'm not sure how it determines, if you remove the law enforcement's records regarding the overdose death, how would you know, in fact, it was coded as an overdose death when it could be misunderstood otherwise? I'll give you an example. I used to serve on the Child Fatality Review Committee, but the thing that we studied in Child Fatality Review is child deaths between 0 and 3. So we knew that if there was a death between that age, we were studying it. I guess the question is how do you determine an overdose death in this instance when age is not the key determining factor?
You recognize, Chair Lady.
Thank you, Chairman. And that's a very good question. The law enforcement wanted to not be required to have to be involved in all that, but I think you still get the same results a lot from your hospital and medical records that they would be dealing in. And so this would keep the law enforcement from being liable with any of their information. And I will add the Senate added this on to the bill earlier this week when they'd heard it. That would be my explanation of it. I'm very involved and been on Metro Drug Coalition Board in Knoxville for many years, and I know this is something that has been at the top of the priority list there for Knoxville, and with adding the surrounding counties they're involved to try to be able to get more of a handle on what these overdose fatalities are about. And I think that's a very good question, and I think it's essentially they've asked to be taken off because of the high liability. However, when Chief Roush was our chief of police there, he served on he actually was president of our board of Metro Drug Coalition. So I think by them asking, it's not going to somehow interfere with what they're trying to, the information they're trying to get from having this group. And I will say kind of like who they want to have at the table, and that might be some of that. So they want public health and social services, the medical examiner, which in Knox County, our medical examiner serves on the Metro Drug Board. And then the court system, DA's office, corrections, the substance misuse treatment providers, and law enforcement would still be involved on that board, but healthcare providers and others in the community. So I'm taking it that with them deleting that it's not going to interfere on their results.
Chairman Williams, and I will note that we do have some folks on the speaker list if we do need some more clarity, but you recognize Chairman Williams.
Thank you. And I think she answered my question pretty well. I do know, being up here for a hot minute, that Director Roush was involved in local law enforcement there in Knox County, and that he did deem certain deaths to be treated as overdose deaths because they wanted to come to the bottom of what was going on. So I get the reasoning behind that, but it may be that someone wanted to protect the perceived value of their loved one, and they didn't like the fact that somebody was treating their loved one with an overdose death. They might like better to know that that was a heart attack instead of an overdose death. And so I get what we're trying to do here. I think the bill is noble in its ideals, in that how we are able to get to a better understanding of the overdose deaths across our state. And so I look forward to supporting your bill. I do think as we go forward, it'd be good to have a sidebar discussion about that. But for my purposes, Chairman, it wouldn't be necessary to bring someone else up unless you wanted to. Thank you.
Thank you, Chairman Williams. Appreciate you sharing your past experiences and knowledge of the issue. Any more questions or comments for the sponsor? Seeing none, you ready to vote? All those in favor of sending House Bill 566 as amended to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Chairman, and thank you, committee, and especially from my representative Williams over here. Great question and your dedication, because I would just say, we kind of were getting a little better hand before COVID hit, and then we've seen it start back up. So I appreciate your all's concern and your passion about it also.
Thank you very much. We are now on item number 19 on the calendars, House Bill 1511 by Representative Wright. Representative Wright, you have an enthusiastic motion and second on your bill. We have a couple of amendments to choose from, and once again, with the posture of the committee coming to order today, we do have an amendment that I believe I'm told you want to go with is drafting code 6710.
That's correct, Mr. Chairman. Thank you so much for adding this to the agenda. This is the youngest bill on the Hill, and I know I'm standing between adjournment and supper.
Thank you very much. Well, we are going to go ahead and place amendment drafting code 6710 on your bill so we can have a full discussion of it. All those in favor of placing amendment code drafted 6710 on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. We are on House Bill 1511 as amended. You're recognized, Representative Wright.
Thank you, Mr. Chairman and committee. The bill, House Bill 1511, is a concept of small residential home for elderly folk of up to 7 people inside a community setting where basic support services are provided to assure independent living. This is being set up with a set of rules and licensing, rules being things like how to report incidences of abuse and neglect, or how to deal with penalties for daily violations. The contract would be, or the provision of service would be for room and board, meals sufficient to meet dietary needs, limited management of medication, and the contract which would exist around this would be for the type of services to be provided, cost of this particular type of care, and the procedure for transfer once a person becomes more requiring of care than can be provided in this particular small setting of group home. And with that brief explanation, please let me stand for question.
Thank you, Chairman, or thank you, Representative Wright. We will go first to Chairman Jernigan, and then we have a couple more questioners. Chairman Jernigan, you're recognized.
Thank you, and I'm going to support your bill. It's a good bill. I think you said up to 7 people, but I think it's up to 4.
It's up to 4.
Right, okay, I just wanted to make that.
I'm sorry if I misspoke.
I just want to make that correction. All right, thank you.
Thank you. Chairman Williams, you're recognized.
Thank you. Chairman, I think your intent is extremely noble here. I will say I would be remiss if I didn't say that I share that I have some concerns about it. If someone were to come into your neighborhood and want to install one of these ends, it want to set what would be considered a small 4-bedroom house for this kind of facility. If the current planning and zoning doesn't require anything, is there anything to prevent someone from putting this in any residential neighborhood in someone's community?
This installation would have to comply with local zoning.
And in the event that I'm sorry.
Chairman Williams, recognized.
And in the event there isn't zoning, then the answer would be yes.
Representative Wright.
Thank you, Mr. Chair. The answer would be, to try to make myself clear, this type of home would have to comply with existing code. And let me, please, if I may, give an example. Within the 8 mile that I'm off Interstate 40 in Knox County, I passed 2 group homes for not elder adults, but 3-person homes that comply with Knox County zone and code for, these are homes for people with mental challenges. These homes that we're discussing licensing here would be for those folk that could possibly be on their own, but are just over the edge of not being able to maintain their own private living and would move together in like groups of 4, up to groups of 4. Now, if the zoning was saying it could only be 3, which is what I'm referring to with the mentally challenged homes that I pass, then the home would have to be 3. But statewide, it would be up to 4 if it's within zoning for that area.
Chairman Williams.
And I appreciate your explanation. In this instance, I have in my district one of those mental health group homes, of which local law enforcement is called quite often because there isn't a secure place or as good a management of the people there as there should be, and because they're called, but because it's in a residential neighborhood, it's very difficult because they don't have planning and zoning. It's very difficult to locate those people because it is in such a rural area. In the instance of this, prior to this bill, we had a bill of which we had Alzheimer's care, and as you're well aware, this General Assembly has spent years providing for Silver Alert recognition on the back of IDs to put that some people are their information as it relates to contacting somebody in a Silver Alert. I have had in my own community a member of my third house down neighbor's congressman's mother walking down the street in a pretty rural area. If I had not seen her, I don't know where she would have ended up. So I'm a little bit concerned about that. I felt like that it would, if they were located in areas of medical services or somewhere where there could be more oversight or attention, I probably would be more comfortable. But currently, I'm just a little bit concerned that we might create this pathway by which we lose control over time. And so just wanted to share my thoughts and concerns.
Representative Wright, you're recognized.
And thank you, Mr. Chairman and Chair. I agree with you. I'm in agreement with you in that we should not be creating a nuisance in a community. There is a balancing act here that we will have to maintain people getting out of their single-family residence, but not necessarily needing to transition to a more controlled setting. And the rules, the last set of things that I said in contracting dealt with, there are procedures that need to be in place that when people cannot live in this setting but need more control of their medication, more supervision, and they're being able to, and I'd have to call on members of the committee to give me the proper technical terms of how to refer to taking care of yourself, that they would not be allowed to be in this contracted setting in the future, that they would have to move to a more controlled format of care.
Thank you. Representative Mitchell, you're recognized.
Yeah, thank you, Mr. Chairman. Yeah, and my concerns are the same as Representative Williams. I've recently had something similar to this in my district, and it's in a pretty rural part of the district on a very heavily traveled road. But my problem is, you know, these homes have got to go somewhere, you know, and everybody's not in my backyard. But my problem with the one that went into my district was the notification of the neighbors. The neighbors had no idea this was happening because by state law, X number of unrelated people are allowed to live in a home. So this house was on the market, sold, and they didn't know it until, you know, the remodeling contractors were coming in there to add X number of more bedrooms to this home to have one of these homes. And like you said, this is a contracted situation, and most of the people who run these places, great people, they're going to do the right thing, but there's a certain number of people who want to keep that contract more than they want to do the right thing. So, you know, I see this as a great opportunity that, you know, with your bill, we could also put some type of notification to the neighbors for, you know, X number of feet that this place is going into, that they have to notify the neighbors that, you know, this potentially could happen. Because the one that happened in Metro, you know, we've got pretty good zoning in Metro, but there was nothing to stop it. Only state law requires it. State law allows so many people non-related to live in a home, and nothing we can do. So, like I said, I think what you're doing is good, but I think people living around these homes also have a right to voice their concerns.
Chairman Wright, you're recognized.
Yes, thank you, Mr. Chairman, and thanks for your concern. This is something that should be addressed because I have seen, not in the two settings that we've talked about so far, but in the setting of people returning from being incarcerated, living in group homes, just being in the middle of a community and causing disruption. The thing that I want to try to convey right now, though, is that these situations that we're describing exist right now. There are people putting up people in their homes trying to avoid being licensed and contracting and providing a good service. And this is brought to me by Aaron Bradley in Knox County, East Tennessee Human Sources, saying that they're frequently in residences where some oversight is needed of the people providing the facility, and I think that's what we should be addressing today. We should be trying to get there as opposed to closing, looking at it with a blind eye on what exists today.
Thank you. Chairman Jernigan had a follow-up question, and then we'll go. Chairman Jernigan.
I do. And this bill is fixing what we passed last year. And it creates this residential home, and it's going to be under the Board of Licensing and Facilities. And what it does, again, we're trying to keep people out of institutions. This is going to be for folks for activities of daily living, nothing medical, right? This is going to be for help them when they groom and feed and toiletry and bathing and dressing. And this is going to be something where they do the laundry. This is not, they don't need to be in a home. We have a situation where we can put them into a single family dwelling and not be in an institution. And that's what we're trying to move forward. So we regulate it. We tell them who can be in there. It's got standards. And this is an ideal situation for elderly folks to be able to maintain some quality of life. And this is not going to be, in the minute they need some kind of medical need, then yes, they go to where they can do that. But this is an ideal situation. It's similar to Choices, except it's not with TennCare and diagnoses with disabilities and elderly where they have support. But this is a different situation. Again, this is what we passed last year. We're just fixing it because last year, when they went to Aging and Disability to get their license, they said, well, we don't have a license for this. So we need to come up with something new. And that's what we did. So we created this new licensure. We put it under healthcare facilities because that's where a license can be held. And then we're able to do this for these folks. I just want to kind of clear this up of what it's doing and what we're trying to fix from last year. Thank you.
Thank you,
Chairman Wright.
Thank you, Mr. Chairman, and thank you for a better explanation of the circumstance than I can give. What I hope is that you can support this and help me preserve this bill so we can move something forward addressing the concerns that people have raised today.
We're going to go to Chairman Dr. Terry first, and then we'll go back to Representative Williams, or Chairman Williams. Chairman Terry.
Thank you, and I'm just trying to get some clarity here. Last section of the bill, for the purpose of promulgating rules, the act takes effect upon becoming law, but all other purposes, the act takes effect July 1, 2024. And so would it be that these particular homes would not begin until 2024, therefore they're promulgating rules, and then we have time for the locals to put in their ordinances or standards or whatever? Is that the intent?
That is, thank you, Mr. Chairman. That is my intent.
Right.
And that is the intent of the people that may hopefully buy into operating this licensing and regulation.
All right, thank you.
Thank you. Chairman Williams, you're recognized again.
Thank you, and thanks to my good friend from Davidson County whose father lives in Putnam County. I do appreciate his description because it does help me a little bit, but I guess for the sponsor, maybe for him, the part that concerns me is it says in Section D, page 6 of the bill, Section D says, a Level 2 license allows an adult care home provider to serve adults requiring specialized services. As used in this, specialized services means provided to ventilator-dependent residents and residents with traumatic brain injury as defined by 6855-101. And then it goes on to talk about these folks and the different, so these aren't, people that need assistance just with bathing. I mean, these are people with some real healthcare specialized services by definition.
Yes, thank you, Mr. Chairman.
Yes.
And Chairman Williams, that concerns me also, and leads me back to a statement that I've already made. Of the concerns of the committee, I need to know what those concerns are, because this bill is a second amendment over the weekend. It's not, this bill's not a week old, and it is coming to me. I'm totally unprepared to be a healthcare person, but it is coming to me from, let me be blunt, from the Senate of a person that's concerned about people right now living in this circumstance, but the circumstance not being controlled properly by the state of Tennessee. And continuing with that, back to then where this circle started, I do not like what you just read. I do not think it should be in there. And again, I would like your support in preserving this bill so we can stand to vote another day, because this bill belongs to this committee.
Thank you. If the committee would like, we do have a couple of folks that could speak, both legal staff to address Chairman Williams' question on the level 2 homes in subsection D we had. We do have someone here from the Health Facilities Commission, if the committee would feel that would help the decision-making process. Without objection, I think there's a unanimous yes on that. Without objection, we will go out of session. I'm going to go first to legal staff to discuss Chairman Williams' question first, and then we will ask Katie Thomas from Health Facility Commission to come forward as well, if you could answer some questions. We're out of session, so legal staff, you're recognized. If you could please tell us who you are.
Matt King, Committee Counsel. Chairman Williams, your question about the Level 2 license and the reference that's in there in that subdivision D, that speaks to adult care homes, and that's a different defined entity than these small residential homes. And that is in part, the way this one is drafted, it's bringing in large sections of code, because the term small residential home, that is the newly defined term, is being added a bunch of different places, and rather than have 50 bill sections that say take it out here or add it here, it's kind of copied it in, added it the places it needs to be, and that part is just copied over, so a lot of that's existing law, and so that part wouldn't really apply to it. And then the services that these homes can provide are listed. Is that in subdivision? What page is that? Page 13, subdivision B1C. B1C on 13 lists what these homes can provide, those types of services. So that's where you can see what the newly created small residential home is actually allowed to do, and kind of where they're constrained. It says persons who operate small residential homes shall provide to residents room and board, meals, limited management support with the self-administration of medication, including assistance in reading labels, opening dosage packaging, reminding residents to take their medications, and observing the resident while taking medication. And so that they'd be limited to that portion in terms of the medical assistance that they could give.
Any questions of legal? Perfect answer, it was told. Any more questions of legal while we're out? We're still out of session. Ms. Holmes, if you could, Thomas, forgive me, I'm looking at some other name here, Katie Thomas. Katie Thomas with the Health Facilities Commission. I apologize, I got your name wrong. If you could maybe correct me and tell me exactly what your name is and who you're with, and address the committee. You're recognized.
Thank you, Mr. Chairman and committee. My name is Katie Thomas. I'm with the Health Facilities Commission. I'm happy to answer any questions that you may have.
We're out of session. Questions of Health Facilities Commission? Chairman Williams, we're waiting for you. There you go.
I feel like the guy who showed up late from home. I can speak from the floor even though I'm not prepared. But I think in this instance, do you believe that this level 2, or would you be licensing, not level 2, would you be licensing this new facility? No?
Yes, sir. So the small residential homes, that is a new licensure type under the Health Facilities Commission.
Right. As you may or may not know, we spent a lot of capital last year discussing sprinklers, registering homes, and things of that nature through licensure, because there were many non-compliant facilities across the state, and we were asking them to trust us, help them help themselves, and it didn't work out very well. I guess, are you at all concerned that the language of this bill would not create an environment for this new licensure that we're currently living in with that licensure?
So that is a good question. I'm not sure if I can completely answer it. I would say that the legislation, this amendment does provide evacuation plans that are required to be able to get everybody out in the case of an emergency. So that is a part of it, the fire safety.
Okay.
Chairman Williams.
Completely unfair question before, but another, I followed up with another unfair question, and that is I think what was happening was there was a desire to require sprinkler systems and fire alarm systems in existing facilities that you weren't reviewing, that the health department was reviewing through their facilities. What we were trying to do is ask those people to come along and provide those additional services. And in the process of that discussion of that administration bill, even though people wanted the oversight, they couldn't meet the financial requirements or guidelines to update their facilities, a problem which we have today with daycare all the time. And so that was the question, and that's the reason for the question about that before, because my fear is if, even though in this bill we have all these different requirements as it relates to what has to be done to the facilities, how it has to be protected for this new licensure, as to whether or not we will find ourselves here the same way we found ourselves there. But what I realize now is that's not a question that you can answer. So thank you.
Thank you. Ms. Thomas, anything to follow up?
Just thank you for the question.
Okay. Chairman Terry, you're recognized.
Thank you, and appreciate you coming and answering. So for the purpose of the rules and getting the rules, how long will it take them to get that through? And then in the event that we wanted to potentially amend this for full, as far as adding, something with locals getting to be able to put their zoning ordinances, I mean, how long does that take? And obviously, if the rules get through, and then we would have a chance to look at what was there, and then we could potentially come back, assuming this bill passes, come back and tweak something in the rules, we could do that. Could you answer that?
Yes, sir. Thank you. So I will say, to promulgate rules, it takes about 6 months. We have to go through the Secretary of State's office, and then we come back to Joint Gov Ops with the rules for the General Assembly to approve them. So the General Assembly has a chance to look over the rules.
Okay. So for the purposes of this bill, if this goes through and there's something in the rules that whatever, if we either don't amend it for full, but we catch something that's not in the rules, we will have the opportunity next year to fix that before this becomes effective. Is that correct?
Yes, sir.
Thank you.
Thank you. Any further questions or comments while we're out of session? All right. Thank you very much, Ms.
Thank
Thomas.
you. Thank
I
you,
was
Mr.
thinking of the
Chairman.
actress, I guess, is what I was thinking. Said Katie Holmes. I apologize. We are now back in session, and we are directed back to the legislation. Representative Chairman Wright, you're recognized again for comments.
Yes, thank you, Mr. Chairman, and thanks to legal for helping me wrangle my way through the words of this, like 16 pages. But if I would have remembered reading the very first page, about the middle of the page where the section 2, paragraph number 1, it names several settings of licensure and control. And I really like bills that are written this way because you get all the words. You don't get replace whereas with therefore, and replace as with but, and with or, and then you can't piece it all together. This 16 pages is a recapitulation of what current code is, the things that currently exist, and we're adding this one terminology, small residential home. With that, Mr. Chairman, I still stand for questions and request your support in preserving this bill and helping us move on with helping the older folk in the state of Tennessee.
Thank you, Representative Wright. And you did come to me less than a week ago, truthfully, and begin discussions on this. So I know this is something that was thrust upon you to carry this. Do you have any questions or any more questions or comments of the sponsor? Are you ready to vote? Let me make sure that we are back in session, just to be sure we are back in session. Are you ready to vote? We are voting on House Bill 1511 as amended. All those in favor of sending the bill forward to full health committee, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. I think we've still got some work to go on this legislation in full and possibly in other places, but your bill moves forward, sir.
Thank you. First, let me address the committee. Thank you so much for letting us move on. But second, Mr. Chairman, I appreciate you considering my request because it has been less than 7 days.
Thank you very much.
Since this came up.
Thank you.
Thanks, committee. Thanks, Mr. Chair.
Thank you very much. Ladies and gentlemen, as the song goes, I believe we've come to the end. This has been a tremendous experience for myself. I've enjoyed getting to know you as committee members, and the debates and the work that we've done has been exemplary, and I want to thank you very much. Chairman Dr. Terry, you're recognized.
Thank you, and before we adjourn to the call of the chair, I just wanted to thank you for the work that you have put in as chairman of this committee. It's been a pleasure to serve. I think the entire subcommittee and the work that the subcommittee has put in, if you watch, and obviously we're all in the full committee, but if you're at home and you're watching the full committee, the efficiency that we're able to do the full committee is because of the work that's put in this committee and the work that you've done as chairman. And so I would like to thank you for what you've done, and those that are out there, let's give the chairman a round of applause.
Yep.
Thank you very much. Chairman Jernigan.
Yes, sir. I'll echo that. When I heard you were going to be the chairman of the subcommittee, and I went as fast as I could. Y'all know that's fast. And I went up to and said how great it was going to be, and you lived up to the hype, and you've done so well that I'm going to support renewing your contract for next session.
Well, I'll be very honest, it scared the heck out of me, so you had more confidence than I did. I do want to thank the folks, and I want to make a special thank you to our folks, audiovisual, the folks that run our dashboard, the folks that run the cameras, the folks that get this meeting out to the public. This was a very quick turnaround. As you know, we went right from full health committee, transitioned very quickly. They were able to pull the calendar up on the dashboard. Folks with audiovisual were able to get us up and going and the public watching this very quickly. So I want to thank them personally. I also want to thank the folks who really got the work done behind the scenes here. My legislative assistant, Shelley Adams, is tremendous. Our committee clerk, Ailish Sweeney, thank you so much for that. Committee analyst, Mike Critchfield, thank you so much, Mike. Our main attorney, Caroline Miller. Caroline, thank you so much for coming to the legislative process. You've been great. It's been a wonderful experience getting to know you. Matt King is in here today. Thank you, Matt. We had Anastasia Campbell in here several days. My buddy Tony Townsend, my sergeant at arms. We had several sergeant at arms throughout the meeting. Our library and archives, Perry Davis, and with us today we have Caitlin Bowling. So all the folks that go to make these meetings happen and these meetings a success, we've got a great team. So I want to thank you very much. At this moment, we are closing House Health Subcommittee. Subject to the call of the chair, we are adjourned.